Hello everyone. I'm just back with another video as I promised, with the update on my LINX procedure. This is a 2-month update on the procedure. I don't think I'm gonna get into too much on the how I'm feeling part, and because it's just way too early. I'm gonna talk to you about the early stages for sure, but what they've told me was that it could take up to 3 to 4 months for the surgeon told me it could take 3 to 4 months for my body to heal, right? And it could take up to 6 months for it to see if it's functioning well, and there's some cases that it could take up to a year to see if the device worked or not. And the reason I'm telling you these different numbers and the different time periods or time frames is because the surgeon that did my surgery, he was one of the first people that actually was part of the studies of the LINX procedure. His name is Dr. Daniel Smith. So he's not just getting this evidence from readings or from just studying. He was part of the study. So I told him what I was feeling when I went for my first month post-op, and he was pretty straightforward with me. I asked him questions as well that I needed to get out of my head. So as for the LINX procedure and how it goes, it was basically a LINX implant with the Nissen Fundoplication Takedown. If you guys see and watch my other videos, I guess you'll understand and catch up with where I'm at with my stage and my health and my progress as well. So I had that on July 18th of this year. So it's about 2 months and a week, or months and 2 weeks maybe. So about the almost 3 months mark, 3-month mark. So prior to the surgery, first of all, for any LINX people that wants to get the LINX, you have to be qualified. So in order for me to be qualified, I had to get different testings done that I had done all of them already prior to the Nissen Fundoplication surgery. So I was already used to them and I knew what to expect. I got 3 testings done, which are the barium swallow. And for some reason, when the barium swallow, I never get like bad news from it. It's not that I want bad news, but I don't get a bad readings or bad results. It always shows that from the barium swallow that my everything is fine. I'm not regurgitating, or I don't have a lot of acid, or I'm not any food contents coming up to my esophagus. So I've done 2 of those, and on both of them it basically turned out the same way. I also had a manometry study, which is very important because it will determine the amount of pressure that your esophagus is creating to open up, to see if it will be able to open up the LINX. So in order for you to open up the LINX, you have to have a certain number to create pressure. I don't remember what mine exactly was, but I believe it was around a 35. And in order for it to open the LINX, the amount of pressure it takes is 20. So there's actually 2 pressures, and one's going down that your esophagus is creating, and then also there's actually pressure pushing up to your LINX and your esophagus. So I didn't know that, and I think the one that your stomach is producing, it's around a 16. So it's low. The LINX should be high enough, which is a 20, so food content wouldn't go back to your esophagus. But your esophagus should create enough pressure for it to open it. So that's the way the science works. It's pretty straightforward. If you're talking to your surgeon, you can talk to him about that, her or him. So when I went into the day of the surgery, I talked to my doctors about the heart issues that I had because of the prior surgeries, or because of what the gastro issues do to my heart and my heart rate. And gladly, he told me that the anesthesiologist told me that there's actually medicine or medication that they give you if they see that your heart rate during the surgery goes up, because that was one of my worries. because from my Nissen Fundoplication surgery, if you've seen my other videos, I woke up with like my heart racing really fast, and I felt that, and it was like that for about a couple hours, maybe an hour or two for sure. And I didn't want that to happen again, just because my heart just overworking, right? So he told me that they have medications that made me feel really good. It made me feel more safe. And right before the surgery, they gave me medicine to just slow down and just relax, feel relaxed. You know, don't let my nerves get into make them worse. Period. And they gave me some medicine. And as soon as they gave me the medicine, though, I feel like the warmth and like the hot in like my chest. So because of these issues, I've built anxiety over time, especially over the last 8 months. I'm suffering from like mental health because of these issues. And I'm probably going to make a video regarding mental health and what GERD does to you, the way it affects your lifestyle. Eventually, like soon in the near future, for sure, I'm going to make some more videos. I'm thinking about just making so much videos or so many videos because so many people suffer from different things. And I feel like I can relate to a lot of them, and there's a lot of people that have had good advice for me and what I've gone through my YouTube comments and people that we just communicate. So that's been very helpful. So I'm probably gonna make more videos. All right, so I don't want to deviate more into that. So they gave me that medicine. When I felt that warmth, I started getting scared, and I called the nurse and I told her, I said, you know, my heart rate is going up. And she told me, oh, it's okay. It's normal for people to be nervous. And, you know, if your heart rate's not over like 130, you know, I don't want to be I'm not too worried about it. And eventually, when she told me that, my heart rate went down. I guess, you know, my anxiety started decreasing, and I didn't even feel when I got into the surgery room. He told me that, the surgeon told me that the surgery was going to take about 3 to 4 hours because it was just an extra hour because of he had to take down the Nissen Fundoplication. He also went inside and he took out the mesh from the last surgery, because from his experience, the mesh can cause a lot of inflammation in those areas. So he went down and he took down the mesh as much as he could. He left some on there because I believe he told me there's like some blood vessels farther in here that he didn't want to touch. You know, he didn't want to risk anything. So I appreciated, you know, that part. But he took down the mesh, and then he redid my hiatal hernia, and he implanted the LINX. In 3 to 4 hours after that, I was out. And as for my heart issue, my heart racing, it was pretty normal when I got out. I remember it was around 100 beats per minute, which was all right. It was pretty normal, and it stayed like that for a while. But then it went back down eventually throughout the night and all the medication I was getting. He did put me right after the surgery. He told me to be on a 2 or 3 day liquid diet, because he wanted, you know, the inflammation to go away a little bit before I started implanting foods. So what I used to do was I used to mix like soups, and I used to blend them. Tell my mom to blend them for me. I would go to Panera and get some soups and just blend them, and it would be just very basically liquefied. And it tasted, you know, it's not the same, but I guess having just, you know, some sort of tasting in your mouth that is just considered food, then it was good. It was good. So that's what I did with most of my soups. And I was just on a liquid diet for about 3 days. After the 3rd day, I started implementing small things that I felt like it wouldn't cause my, you know, my LINX to feel worse, or I didn't want to get anything stuck in my esophagus. So I believe I've had maybe like 1 or 2 episodes that I've gotten food stuck in my esophagus, and it's the worst. So I'm glad that I feel the LINX, that it's working, right? So one of those times I actually turned very white. My mom got really scared. I got really scared. And the good thing was that I was able to throw this up. So for the first time in about 3 years, I was able to throw up food, and it was stuck. It wouldn't go down. I tried drinking hot water to maybe help it go down, but it wouldn't go down. And it was meat. It was like meat from tacos. So, and the weird part though, I had eaten a taco earlier that day, and it went down pretty fine. But I'm guessing from like those 2 or 3 hours that I didn't eat anything, it got stuck, and I turned white. I'm telling you, I was choking on that meat from the taco. So I put my finger down my throat, and I ended up throwing up. And like I told you, it felt really good. Although you're not supposed to do that, but if my food was not going down after several minutes, you know, I don't want to keep trying and force that, or maybe even choke to death because of that. So I decided to go to get to the extreme and just throw that up, and reminded myself that, you know, the LINX is there, and that I still need to be careful on what I eat and how I eat. You know, chew my food very well, which is very important, especially if you got the LINX. So as for my other symptoms, let me get into the prior symptoms that I did have. So my regurgitation issues, they are not solved completely, not yet. I'm still regurgitating food, which sucks. But I still have hope that the LINX is still working and trying to get used to my body's trying to get used to the LINX being there, right? Because it's been a minute since I've kept food in my stomach, period, maybe about 3 years. So that mechanical issue has not worked for around 3 years in my life. So I do feel it working though. I do feel like the LINX is there, which is a good thing. And like I said, I don't want to get too much into how like my issues are going, and because it's just, I feel like it's too early. But my early issues or my early symptoms, I'm still regurgitating. Acid is not even bad at all. Because if you know me, if you see my videos, if acid hasn't been my struggle. I talked to someone who had major acid reflux and just the acid was like their problem. I told them, I said, listen, if acid was just my problem, I would take that over the regurgitation of my food any time of the day. Like in a heartbeat, I would trade the heartburn for food regurgitation. Because keep in mind, food regurgitation is actually food content, the food that you just ate, in your esophagus. So whenever you go to sleep, you get that back into your esophagus. Throughout the day, you get that back into your esophagus. You know, you're not supposed to have that in your esophagus, period. And with regurgitation, acid comes with it, right? So that even makes it even worse. So it's like a double-edged sword that I have to deal with. And just the regurgitation causes so much pressure in my chest area. You know, in my chest cavity, and it's worse. So if you ask me what is worse or what I would take the acid any day over my regurgitation issues. And that's just the way I'm feeling. Everybody is different, of course. And I told her, and she was like, hell no. And she was like, and we agreed that, you know, since she never had my issues, and I never really had suffered so much from the acid, we were like, yeah, you know, it's because we're going through different stages and different things. So as of right now, I am having a lot of spasms, and also I am having a lot of some sort of pressure in this area, and I don't know if it's from the hiatal hernia repair, because the surgeon told me that from after the first month or so, I was like 80% healed, but the last 20% can take up to 3 to 4 months to heal completely. So I'm giving that time. I do feel better though from the chest and the not sleeping. The chest pressure that I used to have prior to the last stretch of my Nissen Fundoplication, I feel so much better. Like that pressure I didn't have anymore. When I take a deep breath, it's not there anymore. And of course the Nissen was causing me all these issues that I was suffering from. And now if I have a decent day, just relax, you know, doing regular things, I can get my 6 to 8 hours of sleep. Although I still regurgitate my food, you know, I wake up and I guess chug it down, swallow it down, take some deep breath and go back to sleep. But it sounds bad, but it's not as bad as it used to be prior to the surgery. So the surgery for sure helped me. I have no doubt that it helped me with that area, which I'm happy about. But like I said, now I've been building some anxiety, some sort of depression. Even though I can get some like 7 to 8 hours of sleep nowadays, I still feel fatigued. I still feel tired. My body feels mentally drained. And I know it's my mental health. I've talked to several professionals. I've talked to also people that have gone through the same thing. And obviously your gastro issues affect your mind so much that I think we underestimate it to the point that it affects us. And some people can watching this video will relate that it's worse, right? And your mind can also affect your gastric issues. So I've been going to see a psychiatrist, a psychologist as well, to try to help me with those issues, because I've been suffering a lot mental health, and I mean that. I might look, decent. I might look like I'm doing well, but no, I'm doing my up here. It's taking a toll on me. So much trauma, so much stealing and fighting. It's bound to happen. It's bound to happen if you don't take, if my body's not feeling well. Because like before I've said on my videos, you got to listen to your body and you got to listen to what's going on. So now that I'm healing from this, I'm taking it slow. I'm not able to really work out or exercise. I do walk. I walk maybe 10 to 15 minutes a day. I try, and maybe every other day, trying to get back up a little by little, just working and working. Also giving this time to heal. So I am still struggling. But I feel like it's just part of my life, and I gotta fight with it, right? I gotta keep fighting. I gotta keep looking for answers, because it's been a struggle lately. But like I said, I'm trying to take care of my mental health as well, and I'll make more videos regarding everything that I've talked about today, and get more into depth into certain things, for like example, my mental health, and then more into like the LINX and the difference between the LINX and the Nissen Fundoplication. I'm gonna get more into other things right now. This is just like a generality and just an update to let you guys know how I'm doing and what's been going on with my life. So that's about it, guys. If you have any questions and any topics that you feel like I didn't get into, just ask me in the comments. And people who are keeping up with me, with my life and my journey, thank you for subscribing. I appreciate that. I always try to talk and communicate with you guys as much as I can. I know from my videos, I've talked to at least maybe 5 to 6 or 7 different people, like over the phone. Whenever I have time, we talk about it, and we're there for each other, right? We all have different experiences, but we always feed of each other, and we always try to give each other advices or whenever we can, and it's a positive and it's a beautiful thing, because it's a good thing to know that people are suffering just like you, and if not even worse, right? So I am suffering a lot, but I always tell myself that I'm blessed, right? As long as you're living, you got fighting you. So hopefully that's a positive that you guys can also stay with. Thank you guys for watching this video, and see you on the next one.